Staying healthy can feel like one more chore on an endless to-do list. At ThedaCare, we make care simple and personal for you and your family. I'm Cassandra, and this is Help Inspire Talk. March marks Colorectal Cancer Awareness Month. It's a disease that remains in the headlines as diagnosis in younger adults continues to increase. Colorectal cancer is the third most common cancer, but it's also highly preventable and often curable. In today's episode, we're talking with a pair of experts about risk factors, prevention, symptoms, and the importance of screening. We're talking with Dr. Joseph Bovi, Physician Chief of ThedaCare Cancer Care. Thank you so much for being with us, Dr. Bovi.
Thanks so much for the invitation, Cass. It's a pleasure to be here.
So to help us understand what this disease is, we're going to play a little game here. We're going to do a 4, 3, 2, 1 countdown, and we're hoping that you can expand on some of the topics.
Happy to do that.
Okay, let's take a look. 4. What are the 4 main symptoms people should watch out for?
That's a great question. So the 4 symptoms that we worry about with colorectal cancer are unexplained belly pain, unexplained diarrhea, bleeding from the rectum, or low blood counts. And if you have those symptoms, bring those up to your primary care physician so that appropriate investigations can happen.
Mm-hmm. Do sometimes people ignore them because they think it's normal?
I think they absolutely do, and especially when we discuss some of the at-risk populations, younger patients who are diagnosed with colorectal cancer can easily overlook those symptoms.
Does everyone experience these symptoms, or are they sometimes not happening at all?
That's a great point to make. Many cases, and perhaps most cases of colorectal cancer, are silent, meaning that patients aren't having any symptoms. And that again underscores the importance of screening.
Absolutely. All right, number 3, name 3 risk factors for developing colorectal cancer.
Sure, another great question. So age, increasing age, is one risk factor. Another risk factor is having a family history of colorectal cancer or genetic syndromes that would predispose you to colorectal cancer. And then the final one is poor lifestyle choices. You know, a sedentary lifestyle without exercise, obesity, increased consumption of alcohol, increased smoking, eating processed foods. All of those risk factors are going to increase your risk for colorectal cancer.
All right, versus the things we cannot change, like age.
Absolutely. That's something that we can't stop the Earth from rotating around the sun.
Yes. All right, number 2 here. Can you talk a little bit about 2 recent cases in the news, Catherine O'Hara and James Vanderbeek?
You know, I think all of us have heard about Catherine O'Hara's unfortunate passing at the age of 71 from advanced rectal cancer. You know, I think what her diagnosis underscores is that this is a diagnosis of an aging population. Most colorectal cancers are diagnosed in patients that are greater than 60 years old. And it shouldn't cause alarm. What we need to do is actually increase people's recognition of the importance of screening. You know, screening works. Most colorectal cancers are able to be cured if they're diagnosed at early stages, and that's exactly what screening is designed to do.
Mm-hmm. And James Vanderbeek?
That's the other end of the spectrum that's really unfortunate. You know, James Vanderbeek passed away at the age of 48 from advanced colon cancer. And this is an unfortunate trend that we're seeing in colorectal cancer diagnoses, is that colorectal cancers are being diagnosed more and more frequently in patients that are less than 50 years old. And I think there's many reasons for that. Younger patients, at least in this day and age, have more sedentary lifestyles. They perhaps are more at risk of being obese, eating processed foods, increased alcohol consumption. All of those things, as we had already heard about, increase your risk of colorectal cancers. So again, it's critically important to partner with your primary care doctor. If there are any of those symptoms that are happening, you absolutely need to bring those to the attention of your physician so that appropriate investigations can happen.
Okay, those are really, really good tips to know about. Okay, number 1 on here. What is the number 1 most important thing we can do to prevent colorectal cancer?
The number 1 thing that you can do is listen to your primary care doctor with regard to their recommendations for screening. And in this day and age, screening happens at the age of 45. That was actually recently decreased from the age of 50 because of those increased cases of colorectal cancer that we're diagnosing in patients that are less than 50 years old. And there are so many options in this day and age, Cass, for screening. And with your primary care doctor, it's important for you to understand which of those regimens would be important for you or the most appropriate for you.
This has been very great information, Dr. Bovi. Thank you so much for being with us.
Thanks for the opportunity. I think this is just great.
Dr. Maria Rossi, a family medicine physician, is joining us. Thank you for being with us.
Thanks for having me.
When it comes to colorectal cancer, there are often these preconceived notions or fears that people might have. We're hoping that you can talk through some of those fears for us and just give us some information.
Yeah, absolutely.
Alrighty, let's take a look at our very first one here. It says, there's nothing I can do to prevent colorectal cancer.
Yeah, and I would say that's not true. Key things that you can focus on to decrease your risk for colon cancer: eating a healthy diet, which often includes high fiber, plenty of water. We recommend up to 40 to 64 ounces a day, as well as exercise. Also avoiding things like cigarettes and smoking, right? And alcohol use, and also getting plenty of rest. Those things can all be helpful.
Okay. Our next one, it says, I'm way too young to worry about colorectal cancer.
Yeah, again, that's something that is not true. While colon cancer only really occurs in about 25% of family members, its risk is still high enough where you should be concerned about it. So if you do have a primary family member that's developed colon cancer, your risk is greatly increased. So you should worry about it at a young age.
Okay, so really that age, portion isn't true anymore.
True, yes.
Right, all screenings are the same. It doesn't matter which I choose.
That is also not true. There's 3 primary options that we offer right now for colorectal cancer screening. One is called the FIT test, and what we do is we do a stool test that you bring into the office, and we look for blood. If blood is present in there, then the recommendation is to do a colonoscopy. The second one is a Cologuard test, which does look for DNA of cancer cells. It also looks for blood. And then, of course, the last option is the colonoscopy. The colonoscopy is considered the gold standard for a colorectal cancer screen, because if there was a small polyp or an early colon cancer that was found, it could be identified and taken care of at that moment to prevent further concerns or further procedures later on.
Okay, so colonoscopy, gold standard.
Gold standard, you got it.
Alrighty. The colonoscopy prep is so awful and the procedure sounds scary. I just can't. What's your reaction to that?
Yeah, it comes up quite a bit. There's multiple options for prep that you can talk to the endoscopist about. Things that include everything from just a few tabs with 64 ounces of water to lower volume preps. The only thing you'll have to be cautious about is insurance coverage when it comes to the less volume preps.
I mean, the really important thing is just getting the procedure done, right?
Exactly.
All right, Dr. Rossi, thank you so much for being with us and providing all this great information.
Yeah, no problem. Thanks for having me.
And thank you for joining us. If you're due for a colonoscopy, talk with your primary care provider about getting a referral. We'll see you next time. At ThedaCare, we're dedicated to inspiring each person to live their unique best life. And we want to hear what that means to you. Leave your questions and comments below and be sure to like and subscribe so you don't miss a thing.